Hi, it's Dr. Noel Williams, September 8th, 2020. Optimal Health Associates, Oklahoma City, Oklahoma. I'm back from fishing. It was a blast. It's hard to be back in the real world. I did have a whole bunch of calls about COVID while I was gone, and thankfully everyone got better. We did have our first hospitalized patient. I don't know if I mentioned that. Probably the learning point on her was that we really have to get the steroids started early. If someone gets any respiratory symptoms, had a couple more people who had respiratory symptoms, and we got the dexamethasone started early outpatient, and it really knocked it out right away. So we have finally had someone get hospitalized. First patient about 45 that we've treated. Not all of them have been on Plaquenil, but most have. Some of the people we've treated with the dexamethasone never received Plaquenil, and the dexamethasone helped. The interesting thing on the person who was admitted, as long as it's not you, is that it was about day 7 from symptoms, which is kind of the break point for people, and so that's why we have to watch you closely. There are plenty of, well, at least several doctors who are treating people outpatient. There's still, though, again, today I had someone I'm aware of who is probably sick with COVID, and they're just being watched, and that's what their doctor wants to do, and that's what they want to do, which is fine. I just would be more concerned since they have high risk factors, but that's how life is. So we just want to always be aware that COVID, when it hits, it starts an infectious process, which then can lead to all kinds of interesting inflammatory things, which leads to the article. Kim, what's the name of it again?
It was the Bradykinin hypothesis about the supercomputer that analyzed COVID.
So Bradykinin. Bradykinin is a peptide or protein. And so the supercomputer was analyzing everything that happened in all this blood work and came up with the Bradykinin hypothesis, which would be collateral to the cytokine storm. So same pathways, but different. Bradykinin is a peptide that causes vasodilatation on the arterial side, increases in vascular permeability, or the way fluid to come out of the blood vessels, but then it causes a venous contraction. So think, as blood's flowing in, the artery dilates, you get more blood flow in, the walls of the blood vessel, instead of being like this, spread out so fluid can push out. Well, that's not going to happen if the capillaries or the venous side stays open, but if it contracts, the pressure goes up, backflow against the side, so that pushes fluid out. And so one of the things that happens then with COVID is this massive exudative or inflammatory mediator release in the lungs or different organ systems. And so that's the theory, that the bradykinin plays a role. Elevations in bradykinin then facilitate the inflammatory injury, and then that fades into this whole angiotensin converting enzyme number 2 receptor playing a role in that, because bradykinin binds to the angiotensin converting enzyme. So it's just all very interesting stuff. So what do you do about it, though? That's the question. Well, pretty simple, pretty straightforward. I did a quick literature search, and what inhibits cytokine storm? Melatonin. Turns out when you pull data on melatonin's interaction with bradykinin, and then something called interleukin beta 4, which is one of the mediators that can upregulate with the bradykinin, and then prostaglandins, which can then cause clotting or spasm too. Turns out that the melatonin interrupts those pathways. So again, I think as we're learning more and more, and I wish I always knew everything already, but you can only learn as these really, really smart scientists, and this is a supercomputer with smart scientists coming up with this data, and then what I'm doing is analyzing it in terms of how do we affect it. Oh, it turns out it's the melatonin. We need to keep our melatonin levels up. So I probably would encourage everyone who's older or at risk to really try to bump their melatonin up to 5 to 10, probably 10 if you can. If it's affecting you in terms of sleep disturbance, try it during the day. If it doesn't make you feel sleepy when you do a low dose in the day, which it usually won't because it's a normalization agent, but if it does, then we'll just have to figure out some other stuff, and I'll be reading more. The other thing is I would definitely encourage at least 2 omega-3 a day. You want to be taking somewhere in the range of about 1,500 milligrams of EPA plus DHA. And so the melatonin and the fish oil, I can keep it straight, sorry. And then I'll be talking a little bit about bromelain, which is from pineapple, in terms of, because this pathway we have to fiddle-faddle a little different. Bromelain has some anti-inflammatory properties, and it may play a role in this, but I still have to research it. And so that's if you're getting sick. Again, so we're pre-staging your system to not respond aberrantly to COVID. So when you look at all the people who are getting COVID, and there's lots and lots of people at the local universities getting COVID, who some are going for testing, a lot are not going for testing. They're not getting that sick. And again, the reason they don't is because they have natural blockages in their inflammatory pathways, so they don't overinflame. The issue for people in my age group, in your mid-50s and older, is we start to lose some of those protective mechanisms, and we overinflame. And that can happen to people with diabetes. That can happen with people whose immune systems have been radically affected by other disease processes over time and have gotten a lot of chemotherapy. And so you can get more into crazy places. So that's kind of the bradykinin, which is a peptide that does stuff to your vascular system. So
I want to ask a question
Sure.
based on that, just because I know this will be asked. So you said if you're older or have stuff to go up to 5 to 10 milligrams of melatonin, but that's only if you're getting sick?
No, I think as a baseline, I would like everyone to bump their dose up to 5 to 10 milligrams, especially if you're over 40, if you can tolerate it. I think we're going to talk about the path we're on right now, and we need to be aware. We've had this big uptick in cases. I'll post some pictures from a different website that shows our case slant, and I'll do that tonight. It's pretty impressive how our cases have changed in Oklahoma over the last 3 months, and I almost feel at times intimidated by it. We've been having about 1,000 cases a day towards the end of last week. Yesterday and the day before we were less, but it was Sunday and a holiday. We'll have the bump up more so. There's also one other thing to keep in mind, is a lot of the people who are turning positive now, who are college students, aren't going to get tested. They're not that sick, or they're mildly sick, and realistically, they aren't going to go get tested. So just kind of look at the numbers and understand there's a lot more going on. So as we're seeing this bump in cases, my anticipation is I'm hoping it will get a little better as September progresses, but then chances are it's going to get pretty intense in terms of the COVID. So we need to be preloaded. That's going to be the central theme. We need to be preloaded as people who are mature, and then you're going to be in pretty fine shape. Again, kids data so far, school's been open now approaching a month. There's not been some huge uptick in symptomatic infections in younger people. I mentioned this earlier, when I was in Crested Butte, the kids are running around playing sports without masks, and they have about the lowest infection rate on the planet now, or not on the planet, but I'm being a little bit exaggeratory or using hyperbole. So just remember that kids are still going to be in pretty good shape. I'm not worried about them. The data is not showing them. There was a recent thing that they don't get any sicker with COVID than they do with influenza, and the way the article was, and I just find the article so interesting because the tone is so slanted all the time, that this one little summary from one author that's not peer reviewed, that the kids weren't getting sicker than they did with influenza. And that was like, but they're getting as sick as they got with influenza. Well, for the most part, kids don't get that sick with influenza. And if you look at the death rates with influenza for kids, it's not a matter of how sick they get, it's a matter of if they die, and they die much more often with influenza. So again, the markers, it's crazy. And he's talking about crazy statistics. Yes, COVID's going up everywhere. But there was an article today that was the most utter nonsense I've seen yet about the slant against certain activities, which to me is just like, come on, why put baloney out there? So the state of South Dakota has about 129 tracked cases from Sturgis right now, which was about 3 weeks ago. Another entity has about 250 cases. While some people at the, I think, University of San Diego, their Center for Disease and Statistics, put out an article today saying they can account for 260,000 cases of COVID statistically from Sturgis. Total utter nonsense, okay? This is the stupidest thing I've ever heard. And their methodology was they looked at some cell phone data about where people went from to Sturgis and then tracked it. Then they looked at the rate of COVID and attributed the COVID infection rate to the people who came back, even though the rates were all going up anyway. And then part of that study said that the average cost per treatment is $46,000. And so, and when my son Hugo heard that, I was talking to him about it, he says, I think mine was like $15. And and most people don't get any treatment at all, but they said the average treatment was $46,000. So this rally cost $12.2 billion in healthcare costs. I won't swear because there's children, but it's utter nonsense. It's utter nonsense that Sturgis led to 260,000 cases within 3 weeks. You look at spring break when there was a lot more people around and it didn't spread like that. It's just not appropriate science. And again, it's not peer review, and it's the lead story of USA Today or one of them. So I think we just have to kind of ignore some of this and understand, yes, COVID is really, really important in terms of its spread, but I think ascribing these huge numbers to that, because this is the same study group that said, but for the demonstrations, there was no increase. Well, okay. There's no increase for the demonstrations, even though that's when it skyrocketed. And it was the 20-somethings got tired of being at home. There were the demonstrations, and it was late Memorial Day weekend. But that really wasn't that important. But Sturgis is gonna drives me insane. So enough of that, I think. Go ahead, ask me some questions, because I had some other things, but now I'm blanking because I got discombobulated by all these people who pretend to be scientists.
I think you were going to talk about the fact they were going to start counting the rapid tests.
Oh, do not be surprised if Oklahomans get put on a 14-day quarantine for everywhere, because our case rate has gone up. But the state of Oklahoma is probably going to include the rapid tests finally, which I think is kind of an interesting development after a variety of different people's comments. And if you looked at their website over the last month, it really changed a few weeks ago, but about what they talk about. So if we have a 4,000 or 5,000 case jump in the next few days, or 7 or something, I think those are rapid tests. And so the rapid tests, those have been accumulating since March. So it's not like we had a sudden 5,000 or 4,500 increase in one day. They're just adding the numbers up. But unfortunately, that may get misinterpreted by some states, and we'll get banned from visiting or something, which is crazy. What else, honey?
A lot of people have been asking about your vaccine.
So the vaccine efficacy thing, I've started talking about it with some patients at the office, but I promise to do it by Thursday night. I have to read more before. Because I have to be careful, because I'm sure I'm going to, in the end, get crucified, which I really don't care for coming out one way or another about vaccines right now. But just like, I think common sense wise, is this the right time, as I say, that to get the shingles vaccine? Well, that's a great question, because do I think the shingles vaccine works? Absolutely, positively. I absolutely do. It does cause a brisk the new one in particular causes a very brisk immune response. Common sense wise, it doesn't follow to me that, even though I want to get one because I'm 56 and I see enough people with shingles, and that I want to get one, but I don't want to put my immune system through a huge inflammatory response for 3 days, and then have to do it again in, I don't know what it is, a month or two. Again, right now, I don't want to ratchet my immune system way up for something that then if I get COVID, I'm already a little inflamed, and I don't want because everything with COVID is avoiding getting massively inflamed or getting these pathways turned on, because once they're turned on, they can be very hard to stop. And so that one, just as an example, I'm not particularly interested in for people right now, because it's optional. And yes, I'm going to get one as soon as the COVID thing blows over, but right now I'm like, no. So the flu thing we have to figure out. The data is going to be a little controversial that I'm going to go over. It's not controversial data. Actually discussing it is controversial because I think everyone's purposefully, not everyone, a lot of people, 95% of doctors don't know it. The ones who do ignore it for whatever reason, and the CDC has made some active decision making and statistical analysis stuff to make the data look different than what it actually is. So we're just going to have to talk about that, but it'll be Thursday. Tune in Thursday for the vaccine review. That I have a deadline of work because I always have more work to do.
Okay. Have you changed your opinion on Plaquenil? You're not talking about it as much as you were.
I haven't changed my opinion on Plaquenil at all. I think Plaquenil is very important, but it's important for early use. I don't think it's as helpful if you use it for later use. I don't talk about it as much because I've pounded that horse into the ground, and that's my opinion. That's the opinion of a lot of different doctors in the country, a lot of different scientists, but the FDA and the CDC and a lot of people locally are not for it. So you've had my opinion on it. The data has not changed at all, showing that it doesn't work. It does work very well outpatient. That's all I can tell about it. I need a break from the FDA, which isn't going to happen for the Baylor emergency use authorization to get approved, but it's never going to happen. And once you hear about the vaccine efficacy stuff, you're going to understand very clearly why they're never going to approve Plaquenil. Plaquenil's data, I'll just give a little tidbit here. The data on Plaquenil's effectiveness is off the scale better than any of the vaccine efficacy data, yet they act like that vaccine efficacy data matters. I mean, it's easy. Okay, I'm going to give a bigger tidbit. Everything with the vaccine data is observational only, and they go, well, the Plaquenil data isn't worth crap because it's observational. They don't have a double-blinded randomized controlled trial showing effectiveness with a vaccine for flu. For everything, all the other vaccines they do. They just don't with the influenza. And so they're talking, we might say, out a different place than they should be. Because you read this and you study it and you're flabbergasted by it. What else do I want to talk about? I had some other subjects, but the number one thing is take your darn vitamins. This is going to matter more than you can ever imagine over the next 4 months. Oh, positives. The number of cases in Oklahoma is 60-some thousand. It's probably reality symptomatically much higher, but figure at least 5 times that amount to 10 times that amount more people have gotten it who are just asymptomatic. I had someone in today who talked about his wife got antibodies. She had a brief cold several months ago, donated blood, positive antibodies. There's a lot of those people out there. And so when you start thinking, well, we could have 600,000 of those and potentially this other data from the journal Science and some of these other journals that the coronavirus, cold virus is not the coronavirus, COVID virus, probably has given a roughly 30% partial immunity. And that's another, million or so. We're starting to get into real numbers of people in Oklahoma who either have some level of immunity from COVID or some level of immunity from corona. So that starts helping our herd immunity concept. And so I think by the spring, we will be in pretty good shape with herd immunity. Again, there's one non-confirmed reinfection in a guy in Hong Kong of COVID. One in 21 million patients after checking tons and tons and tons for reinfection. So reinfection is not happening. The convalescent plasma data does show huge positive effects, thus meaning it works and protects the person who's sick actively, and it's going to do the same to the people who have it. Now, how long will it last? Who knows, a year or 2 or 3. But we're going to have some partial immunity. And if we get good enough partial immunity, that reminds me of what I wanted to talk about. How important is the vaccine? Well, the 9 or 10 of the big pharma companies who are working on the vaccine sent a letter to the FDA that they were going to abide by the highest standards they could abide to, I guess, today. Why do you have to send that letter? Oh, because you haven't in the past. And you've faked data and you've lied and you've released medicines that are harmful, all for money. and then they build in money to pay for the class action lawsuits and that occur subsequently. So why would we suddenly believe that the big pharma companies who stand to make billions of dollars on this, are they going to be honest? And that's why we have to be very careful. AstraZeneca stopped their study on the vaccine in England sometime this weekend because of a serious adverse event. That could be very important. It could be totally meaningless. We don't know, but it's a big enough deal that they stopped with just one serious adverse event, the entire study right now. And so we're all waiting on what that will be, but who knows if they'll say what it is. And that's the AstraZeneca study on the vaccine. So if you had that stock, I'd probably sell it. No, I'm just kidding. But that's the way it works. I mean, you just have to keep in mind, you really have to be suspicious of anything the government does. Remember, they've already done a study on how to do the propaganda to get you to use the vaccine, and it's a very interesting study. What's the most effective tools to make the public get a vaccine that they're afraid of? And it's about fear and emotional manipulation. And so don't worry, that's going to start pretty soon, and be ready for it. So that's about it tonight, unless you have anything, Kim, which is a long talk, but I've been a little crazy.
Yeah, I have a couple of others. One you've talked about before, but there's probably people, this is getting more relevant. Just safety in traveling.
Oh, safety in traveling. Standard stuffs since I traveled. 1, pulse your zinc is pretty much that night in the morning you go, or that day. Number 2, wear a good mask. 3, bring hand sanitizer. If you're traveling on an airplane, they're going to give you something to wipe down your seat, but I carry hand sanitizer with me. 4, I suck on zinc elderberry lozenges when I travel. And then I will generally repeat that process when I come back. I found it's weird in places other than Oklahoma. People are extremely mask focused. You get humiliated if you don't wear a mask, and you look at their rates of infection and it's way lower. So maybe it matters. So I think once you're out of our state, you're going to find that, unless you go to Texas, you're going to find that you're going to follow the guidelines if you're going to I mean, you can't really go anywhere and have fun excluding Colorado, but that's pretty much what I would do for that. Am I forgetting something? You're looking at me?
No, you were looking at me. There's one more.
Uh-huh.
Is zinc safe to take when you have diabetes and high blood pressure and are on those meds? Will it interfere with those meds?
No, none of the supplements are harmful. That's one of the things to keep in mind. I had this hilarious, it was kind of funny. A very awesome person I have the privilege of taking care of sent me a study on breast cancer and supplements, because when I had taken care of her, I had her on supplements during her chemo, which in every significant study shows benefit and improvement and protection. Well, a study came out that showed that potentially antioxidants increase the recurrence rate in breast cancer. And she was very concerned, which made total sense to me. And as I was reading the study, I read the abstract first, and I thought, okay. And then I started reading through the study, and I started laughing, because here it's published, a peer-reviewed journal article, and the p-values, which they have to be less than 0.05 to have clinical or to have meaning. So you can follow the conclusion, that the conclusions of the study are valid. So if they're greater than 0.05, you can't make any statistical conclusions with meaning. Either you can't give a conclusion based on the data. And so they were like 1.5 and 1. I mean, it was just horrible. It was meaningless data. And they conclude that, yes, these antioxidants cause potentially increases in cancer risk, even though their own statistical analysis showed it didn't. And that's the chronic problem we're having with this medical literature. This study would have never been published when I was in medical school in the 80s. They actually cared about statistics, but now we don't. We just do it to get, the headline. Antioxidants are bad for cancer patients. So that's it. That's a rambleization, but it's just the science is so bad, we have to be careful. So good night.